beneficiary really of home health services.
It's true, you hear
Yeah.
that a lot.
Yeah.
One thing I point out, if folks are interested, we have on our website a link for information about each town, some of the numbers that Michael shared about the city. There's going to be a link there about each town, Swanton, Highgate, and so forth, to let folks get a little peek at the numbers that we are providing in each town, and to say thank you, look what you're enabling us to accomplish, but also to say there really is that need, and we hope that you'll look at that and help us meet those needs. You know, you mentioned you've been here since the 70s when we had about a staff of 6, and there's 200 people now. So it's a large employer in the community, and we're able to reach so many people, as you mentioned. So could you give us another recap on those towns right now that we're having, that need to vote on it, or that it's on the ballot?
Well, I know it's an article warned in Fairfield, as it is, you know, traditionally. So Fairfield is one. I think Fairfax, we're on an article that's warned in the town of Fairfax as well, and then St.
Now the
Albans
city.
And how does the town handle the funding?
The town, it does both a contribution in cash. I don't live in the town, so I'm not sure whether it's part of their budget or whether it's something they vote on. But the town does also, our primary facility is in the town, and we don't pay property tax in the town. And if we were to pay property tax, there would be
that's a great contribution.
A significant contribution made by the town, probably in excess of anybody else's any other municipality's contribution.
We appreciate it. And folks, town meeting's just around the corner, but what if people are heading out, maybe they're going on someplace warmer, or you're sick that day? Can you remind people about what to do if you're not going to be able to make it to town meeting?
Well, in Fairfield, because it's an article in the morning and we hold the traditional town meeting, you can express support to your neighbors and friends that will be attending, but we don't have a facility for you to vote on it.
You might, I think I would suggest that people be in touch with their town clerk to see what the process is to obtain an absentee ballot. I know in the city you can get an absentee ballot right up to the day before the meeting of March 4th. And towns would differ how that works, but you can also get that information on the website, www.fchha.org.
That's it.
And it'll list your town and give you the information you need.
Wonderful, thank you. We're getting close to running out of time. I just want to ask each of you to share one more thing about the agency and about this request that we're making to our towns and the residents here in Franklin County.
Well, I was glad that Michael brought up the history. My dad was an overseer of the poor in Highgate in the 1950s, and I think it was toward the end of the 50s that phased out into other mechanisms. And so we have a long history in Vermont of supporting, filling that gap that we've been talking about, and supporting people in need. So. I urge people to get out and vote and to continue that legacy.
Yes, thank you.
And when I listen to all of the media today with Obamacare and the healthcare exchange in the state of Vermont, and just observing how the healthcare industry is moving, I think Franklin County Home Health is very well positioned to be a key player in that whole thing. And part of the strategy in the future in healthcare is managing that whole continuum of care for folks, and home health becomes a much more critical player in that. And I'm just delighted to see that Franklin County has such a strong, professional, very talented organization to be a player in it.
Thank you.
I guess the only thing that I would add is that I did obtain 150 signatures or so to get it on the city ballot. I met a lot of people. I walked up and down the street of where I live. I went to several bingos where there are large groups of people. And I would say that the support that home health has at least received at those places that I've gone was overwhelming. I'm not concerned that we won't pass the city. I'm hoping that everybody will vote and hopefully vote in favor of home health, but based on the enthusiasm that I encountered, I guess I'd say also surprised that nobody that I knew that I met within the city was aware that there was no contribution being made by the city since 1999. The city has been resting on the efforts of other communities, and it is time for the city to pull its fair share.
Nice. Thank you. Yeah, thank you all for everything that you do and putting your time and talents as part of this organization as well. It makes a big difference, and we appreciate you taking the time today and all the work you've done to help with this effort, and thank you for encouraging everyone in your towns and your neighbors. We appreciate it. And thank you for watching, and if you have any questions about our topic today, you can feel free to call the agency at 527-7531. You can visit our website at www.fchha.org, and again, there will be links there for information about your town meeting and specific information about the work that Home Health does in your town. And you can also find us on Facebook and like us there for information on our news, information about the Blue Jean Ball that will be coming up this fall, and a lot more fun information about the agency's programs and services. Again, we thank you for watching, and thank you for your support of Franklin County Home Health in our community. Be well.